We're Bonnie and Greg Dixon from Storybound TV, and here we're with Dr. Debbie Rodriguez.
And I met Dr. Debbie Rodriguez all the way back in 2008. And I just loved her from the get-go. And we fast forward, we reconnected, and I wanted to know what she was up to, especially during these interesting times. So she is an acupuncturist and healer. So it's been over 15 plus years she's been doing this. But what's really interesting, and I didn't know until we got to talking again, she's a specialist in fertility and women's health. And it's just so exciting to have you on today, Dr. Rodriguez. And you have your Heart of Healing Acupuncture and Reproductive Medicine. And we have, we're just curious for the average person who has never had acupuncture treatment. You know, what is acupuncture and how is that different than, say, some other modalities of healing?
Well, first of all, it's really nice to see you again too, Bonnie. It's been forever. So I'm really happy to be here. As far as acupuncture, it's originated like 2,000 years ago. So it's been around for a really, really long time. And what it consists of are very fine stainless steel needles. The needles are the width of your hair. So they're extremely, extremely fine. So when we insert the pins, you barely feel it at all. So that's probably one of the first things that people are most concerned about. And generally, the treatments will usually last about half an hour. But initially, we go through a whole series of questions and things like that to determine the best way to treat the patient.
Mhm. What kind of questions would you say ask a new client?
Well, first of all, if someone is experiencing, since I deal mostly with fertility, so generally speaking, it will be when their cycles are. Do they have a regular cycle? Is it irregular? How many days apart is it? That kind of thing. A lot of times, women come in that have egg quality problems, so they're not able to get pregnant because of egg quality. And other times they have other issues such as endometriosis or polycystic ovary syndrome, things like that. And acupuncture can be really, really helpful in regulating their cycle and helping their ovulation to become normal. So that's a really big thing.
So you go a little deeper than, say, a typical uh, doctor would, that you're digging a little deeper to find a little bit more about they as a person and their body and everything. And then from there, you create a protocol, I guess, for them. With
Yes,
Mhm.
yes. Now, every person that we deal with may have a different constitution, what we call a different constitution. So that's where all these questions come in. So, say maybe there is a woman who is always cold all the time, as opposed to the next person who is always hot all the time. Maybe person A has a lot of stress in their life, and so they um, they present a certain way. So that person's protocol would be different than the person who is cold and extremely calm, things like that. So everything is really tailored to the individual and how best to work with them and with their bodies.
Mhm. So it
Yeah.
must be also, I was thinking about women, being one myself, um, past childbearing age, mind you, but the main thing is the women's bodies change all through their life. And so with your clinic and your women's health, do you start when they're young and then in a sense go all the way through um, growing up and then childbearing years and then into the crone stage and then the elder stage as well?
Yes, sometimes if I'm fortunate enough to see a young girl as she's reaching puberty, then we can really help establish her menses and have her have strong cycles. And then you kind of follow them through as they get to teenage years, and then they get to more into reproductive years, and when they're looking to begin a family. And so what I also do is help prepare the body to receive a child. So actually, when I usually consult with women and things, I tell them the goal is not for them to get pregnant. The goal is for them to have a healthy baby. That's really the goal. And so we do everything that we possibly can to ensure that. So the first step is to prepare the uterus, to have it be an environment that's conducive to conception, to implantation, and things like that. And then keeping them healthy all the way through to the next stages.
Hmm. I know that you generally work with women, but thinking that there's two that to tango there on this. Do you treat men as well, or is that a different doctor that would do
No, I
that?
certainly do. I certainly do. In Chinese medicine, the kidney channel is responsible for reproduction. So that is the same in men and women. We kind of have the same parts in that respect. But so the nourishing their body, nourishing the kidney energy, and helping them to be the most productive and have high sperm count, healthy sperm. And that's what's most important.
Hmm.
So
Hmm.
usually when a couple comes to see me, they will bring with them of the testing that they have had done. So for a man, it will be the sperm count, motility, things like that. And for the woman, it will be, say, her FSH levels and something called an AMH level, which is an anti-malarian hormone. And that determines the level of egg reserve that a woman has.
Ooh,
So that
that's
gives us
really
a basis.
interesting.
Yeah, it gives us a basis to work, and we start from there and
Hmm.
see what's happening. And at
Hmm.
times, it's totally unexplained infertility, which in
Hmm.
that case mostly relies on me to determine the woman's constitution to see where is there an imbalance in that and where can I help.
Hmm. So, take us from the beginning. So, you're determining what the constitution of the person, and then you lay out a treatment plan for them, and then hopefully they are actually get pregnant and then have a healthy baby. Then from there, do you being a women's health a practitioner, do you continue treatments throughout the after the baby's born?
Oh, yes, definitely. For postpartum, if there are any issues with lactation, that we can really
Mm-hmm.
help a lot with that, as well as help them kind of get back into shape. The acupuncture can help streamline the uterus again, and everything kind of come back to form. So it can really, really be very, very beneficial.
Wow, that's really interesting about that. Of so really helping them prepare to get in shape to have the baby, and then during. Here's a question for you: during labor, are you there as well?
Well, that usually depends. A lot of times we don't have as like a lot of hospital privileges, so
Mm,
I'm probably not there.
mhm,
Sometimes women will come to me if a baby is breech, and there are techniques that we use to help turn the baby,
mhm,
and sometimes we can help them with acupuncture to kind of help stimulate things if they have gone, for example, if they're 40 weeks and they're going to be induced. So they'll come to me first to see if I can do some acupuncture to help spur them on their way so that they don't have to go through the chemical, induction and things.
mhm,
Yeah.
mhm. So, what's your favorite part of the whole pregnancy, before, during, after, helping a woman through this very special time of her life, and a
What,
husband, of course, or partner?
yeah, it's really, really interesting. I think one of the nicest things is At the beginning, everyone is really excited, and every woman's journey is different. There are a lot of ups and downs. A lot of women have a lot of hardships as well, because especially those struggling to have a child, it's really, really difficult for them emotionally. It's difficult on their marriage. Sometimes women feel that there's something wrong with them, that somehow they're inadequate, that they can't provide their spouse a child or something like that. So there's a lot of counseling, a lot of things that go on during that time that can also help a woman, help support her in her journey. And then, of course, once they become pregnant, that's always very exciting. That's really exciting, and helping seeing them through all the different stages and the planning and things like that. And then finally, um, having the baby. That's just the icing on the cake. That's everything. So it's the whole
And
process is just a joy. It really is.
oh, that's so exciting. What actually intrigued you? I mean, there's a lot of different niches and areas a doctor could go in. What intrigued you about women's health, and particularly with the fertility? What intrigued you?
Well, to be honest, um, I do not have children. And what I realized is that a lot of times women are sold a bill of goods, that we're told you can do anything. You can do this, you can do that, you can have it all. And to some extent you can, but biology is biology. And sometimes we have misconception of what that really means. So we kind of go along our life, and then by the time we're 45, you think, "Oh my goodness, I should have a child." Well, for a lot of people, that's too late. Some women can have children well into menopause, and that's great, but you might not be that. You may not be that person. So what I was really interested in was being able to educate women and letting them know that, say, for a young woman who is interested in furthering her career, she can freeze her eggs, and then she can be 45 and decide to have a child, and her eggs will still be 23 or 24, something like that. It's a matter of planning. It's not just always going to be there. And so that was what was really important to me, to help women learn that they have choices and how these choices can impact their lives.
Hmm. I
Yeah.
agree with you. Someone in my family had waited and waited and was in the 45 range.
Hmm.
Just about that time, she got very ill, and the medicine they gave her said, "Don't have children, whatever you do."
Yeah.
And so their plans of having a child were sidelined.
Right.
And I have another friend that had wait. Actually, I've noticed personally that women do wait later and later and later. And so, as you shared that, to prepare the body, because the body's pretty fertile in its 20s.
Exactly. Exactly. That's exactly it. And so now, as we get older, they're a little bit, you really work with your diet. And especially now, so much with insulin resistance, people don't realize what a great role that plays in preventing fertility is insulin resistance and the impact of the diet. Whereas a lot of times, Western docs may not go into it as much with women. So it's really something that I try to stress and explain, the importance of the organic foods and things like that, and exercising, but not too much, because too much exercise actually, in Chinese medical terms, can also be detrimental. So you don't want to go crazy out running all the time and things like that, when you're in that case you're actually depleting your kidney energy. So that's not what you want to do. You want to exercise, maybe walk briskly, but still keep within some boundaries there. So,
Mhm.
yeah.
That's a really interesting point. I had heard that years ago, that the Olympian athletes and elite athletes of the world, sometimes the women would lose their whole menses. They would not have it because they were
Exactly.
exercising so much and lean body fat. They were
Exactly.
just.
and our society is so obsessed with being lean, being lean.
Mhm.
And um, usually, in general terms, when a woman is very thin, she also has a very thin lining in the uterus, which is harder for conception.
I
So
did not know that. That is
it's,
very interesting.
yeah, it's better to have, you don't have to be chubby, chubby, but have a little bit, have
Mhm,
a little bit of weight on you to
mhm,
provide adequate
mhm.
adequate
And
lining.
this is an odd one. Then there's the opposite of where some women in today's Western society that they're quite heavy, and
Right.
so you back to preparing. Do you help those women actually maybe lose some weight before they start to have the baby?
Well, a lot of times, those are the women that come because they cannot get pregnant. They're having difficulties getting pregnant. So then I start them on different herbal therapy along with their diet to help reduce the what we to help reduce weight a little bit.
Hmm.
And not so much that it's a weight thing, but it's how your body is processing the carbohydrates. Generally, when you carry your weight in the middle, in the midsection, you have more of a problem. So you know how they say you're either an apple or a pear? You're better to be a pear. You're better
Hmm.
to be a pear than an apple, because an apple, you have that tire, and that really impacts all of your other organs, and that's a lot of insulin resistance is right there. So
Hmm.
even if a woman is thin but she has that little poochiness, that's a sign that there could be some insulin resistance there. So you kind of have to keep an eye on it and see how she
Hmm.
does and things like
Hmm.
that. So there are a lot of
Hmm.
little tricks and things that you can look for to help a woman further on her journey.
Hmm. If a woman came in for treatment, how often do you treat? I mean, everyone's different, I'm sure. What would that look like for someone who
Okay.
has never had acupuncture before? Like you've diagnosed them, you've got a treatment plan. Like how often does a person come in and have the treatments?
Okay, so a lot of times that depends too. Sometimes folks will come in and they're going to go through IVF in the next month. Well, in that case, we need to kind of speed things up here, and I need to do as much as I can. Now, if someone is coming in and wants to conceive naturally, then we start at the beginning, we go slow, and everything is generally 3 months. 3 months is considered a course of treatment. And the reason for that is that it takes 3 months for an egg. Say if a woman ovulates today, that egg has been in the making for 3 months. It takes 3 months for it to come down the pike. So we have 3 months. So what we do today, as far as herb wise, we'll see the effects of that in 3 months. So that's a really big thing, especially if there's an egg quality issue. That is a really, that's a pretty big thing. Also, if
Mhm,
women experience polycystic ovary syndrome, where they don't always
mhm,
ovulate, and maybe they'll have a
mhm,
cycle every 60 days. In that case, my job first is to regulate their cycle, bring their cycle back down to 30 days, something like that, and then we progress to go further. So
mhm,
generally, the treatment is 3 months, and I see them once a week. That's generally
mhm,
how it goes. Unless, of course, like I said, if they're going to start IVF in the next month, then I try to get them as prepared as I can, because what the acupuncture will do, especially in the case of IVF, it helps to promote more blood flow to the uterus and all the pelvic regions. And so that in turn helps to improve conception.
mhm, mhm. This is so fascinating. I'd heard of acupuncture, and I just knew it mainly for pain. But it's so fascinating that you're able to help women who uh, one of the brightest spots of their lives is to have a child, and that you're able to help them prepare and work with them through that whole process from beginning to birth.
It is. It's very gratifying. It really is. I had a young woman that came to see me who initially she would have a cycle every 60 days. And we worked diligently, and it's a partnership. We both have to come to the table willing to do our part. And so she did her part in taking her herbs religiously and doing everything, and I did my part in providing the acupuncture and things like that. And it took some time, but we got her cycle down to 30-day cycle, which she was thrilled because she had previously all of her life had been 40 days, 60 days, 80 days,
Oh,
things like that. And then just recently she was able to conceive, and she has a little boy now. So
That's
we were
great.
oh,
That's fabulous. Yeah.
congratulations.
Yeah, so that was just, that's just marvelous to be able to go through the whole journey. And especially someone like her really sees the value of how much the acupuncture and the herbs can really help. Herbal therapy is very, very important. Herbs are
Hmm.
very, very potent, and they
Yes.
can really help change things around.
Mhm, mhm. And so, shall we show Debbie's website, Dr. Debbie's website, so they know where to find her
Oh,
in
yes.
Poway, California here? And
So I don't have it teed up yet. Let's see.
oh, it'll be just a moment here, and we'll have it teed up here. And it's really exciting to know that if a person were to take basically an ancient way, but bring it forward to modern times and utilize someone trained just like yourself and specialized course, that they can have help that maybe they wouldn't get in regular allopathic treatments out there.
Right. And it's just interesting. The human body is just so fascinating. We are just fascinating creatures. And to be able to assist and work along with the body is really an important thing. Sometimes the medications that they give them for IVF, sometimes they're too strong. And so instead of them producing follicles, they have none because their body just gets a little bit too stressed out and wigged out. So you kind of have to work with them. And with Chinese medicine, it's really working holistically with the body.
Exactly, exactly. So we're going to take a look at your website here so people can find you. And
Just keep talking.
uh, the main thing is, what if someone were working? I mean, it would be hard to do it without the needles, but can you help people further away from Poway, California?
Definitely, definitely. Right now, as a matter of fact, I'm working on providing subscription boxes for women who are out of the area or in maybe a town where they don't have any acupuncture, to where they
Wow.
still have the utilization of these herbs to help get them through their cycle and help them be regular and to help improve conception. So that is
That's
the
really
way that I,
exciting. So, do you serve people in US, any other countries as well?
at the moment, I haven't, but that is an area that I'm looking to expand to.
Hmm. So your website is the heart of healing. How very beautiful, acupuncture, and then we have here's your mission: to provide the highest quality care in traditional Chinese medicine for the integration of body, mind, and spirit. And you like to educate people. That's and it also looks like you have the herbal consultation as well,
Yes.
which is very interesting. I think the combination of the two is very sounds very powerful together.
Yes, it
And
is. And I utilize all different modalities as far as the acupuncture, the herbs. I use cupping, and something you also use moxibustion. Some women, even though I live here in California, some women are cold. And so nothing happens in the uterus if everything is cold. Everything kind of freezes up. So it's a
mm-hmm.
process of warming. And moxibustion is an herb that we also use to help warm the uterus. So there are a lot of different little tricks and things that we use to help promote fertility.
Yeah. Sounds like you have a lot of intuition uh, to know what's going on with a person's body. And I really honor that because I think in our hectic world, it's rush, rush, rush. Whereas this, it sounds like it's a much more take a look at it, see what's working for the patient, and being patient with the patient.
Exactly. And a lot of times, I think the most important aspect that a practitioner can afford their patient is listening. You know, it's important for me to listen to the patient and really to listen to what they say, but also to what they do not say, because that can tell you a lot. There's a lot of little things, nuances, and things that you can learn. And so there's one thing to be an acupuncturist, that I'm a technician, that I go by a little book and blop 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 put in these little needles, or a healer, someone who really gets to know the individual and who determines maybe some things that they're not so aware of, or some things, when we meet someone for the first time, you don't share all your intimate secrets or your stresses or concerns, things like that. But as a practitioner, I can feel different things in the pulse, and then that will lead me to ask different questions. And so in that way, you develop more of a bond and a closer connection with your patient.
Wow, I'm so intrigued. I'm not again in that position to have uh, a uh, a um, a child at this age. We're grandparents now, but I know that many women are helped and are still to be counseled and guided by your knowledge. And we appreciate you coming on the show today, the Story Van TV. And we look forward to future talks because we'd like to know more. And I'm sure our audience would like to know more as well.
Well, thank you
So,
so much. I really appreciate it. And I would be more than happy to share some other little tidbits,
Okay.
along the way. So that would be perfect.
absolutely. So everyone go to Dr. Debbie's website and reach out
Here,
to
do you want to
her.
read out the?
Yes, let's read it out. It's the Heart of Healing Acupuncture, and how it's so easy to find is put in Poway. Is it Poway? P O
Yes.
W Poway. Poway, and she pops right up.
Yeah, heartofhealingacupuncture.com.
Yes. Indeed. Well, thank you again, and we look forward to our next episode with you down the line.
Thank you again. You take care.
Okay.
Bye.
Bye
Bye
bye.
bye.